CQ Radio, Sarasota, Florida. Today, our great guest is Dr. NIKKI Kitty in Singapore. Dr. NIKKI is in the front line combating COVID-19 virus in Singapore. Dr. NIKKI, your country has been very successful combating this virus. You are probably the number one country in the world who have succeeded in reducing the number of COVID victims in your country. Can you tell us how you guys were able to do that?
Sure. Singapore has been praised for its very fast response. I think from the experience that Singapore had with SARS virus in 2003, Singapore knew how quickly this virus can get a hold of your health system and take over if you don't act fast. So I really admire the Singapore government for acting decisively and quickly because they've been through this before. So they took it seriously as soon as the cases were announced in China. Preparations had already been underway in Singapore for many years, not just this year. Singapore has been preparing its health system for another SARS-like event since 2003. We have built our hospital capacity, our ICU surge capacity, so we're able to quickly double or triple our ICU capacity if needed. We built a specialized infectious disease center to quarantine cases in the event that an outbreak happens. We've used a lot of high-tech technology to trace the contacts of cases and be able to trace every case who they went around and met in the society, and then quarantine those people. So I'd say if those are four things. The number one, the advanced planning that we're doing years before this virus came out, after SARS, really made sure our system was ready and invested a lot of money and training into that. The second thing, we tested as much as possible in the beginning of the outbreak so that all the cases could be quarantined. And third, we really trace the contacts of all the cases that we test and make sure that those contacts are quarantined as well. So if you use that test, track, and isolate approach, you can contain and ring fence an outbreak before it gets much bigger. So once you let cases go out and you don't know who is infecting who, it's very hard to contain it and not have an explosion of cases like what happened in Europe and what's happening in the United States.
So
and
the resume,
underlying all of this is the incredible amount of trust that Singaporeans have in their government. They really trust that the government has their best interest at heart, that the government has a plan. And so people were really cooperative with the measures that the government is putting in place, and they were all willing to pitch in and help in any way they could.
So what I'm reading here, you were very good in advanced planning, testing people, prepare prevention, and tracking contagious people. So how you track somebody who landed at the airport and go into general population? How you do that?
So Singapore employs a very huge army of what we call contact tracers at the Ministry of Health. So we've trained quite a large group of people to be able to follow up on and like that time it was a lot of imported cases from China. So anyone who came in from China, they automatically would be under a 14-day self-quarantine. So if they were visiting someone, they'd have to stay in that house. If they were in a hotel, they'd have to stay in that hotel room. And the government would call you every day and just randomly check on you and make sure that you're where you're supposed to be. They back up, this quarantine with teeth. Legal consequences if you don't follow the order. You could be fined. You could be jailed. Your work permit, if you're not Singaporean, could be cancelled. Your passport could be cancelled if you're a citizen. So the government was very strict. If they tell you to stay at home, they're going to check on you every day. They're going to ask you to record your temperature every day. So even I am at work. Everyone who works in Singapore has to record their temperature twice a day, and you have to upload it onto some system that your employer keeps. So it's a requirement. You always remind each other, have you taken your temperature? You have to record your temperature. So it's this way that you're able to keep track of the population, catch the early symptoms. Any traveler who's in, you watch them for those 2 weeks if they develop any symptoms. And then you're able to easily contain if those people do end up getting sick.
Okay, what are the advantage of testing? I mean, how many people were you able to test a day or in a week?
So our capacity, I wouldn't be able to tell you the numbers off the top of my head. It's not as much as what Korea is testing. I think in Singapore, we applied a more selective testing approach because on the background, we were doing a lot of surveillance. So we're doing surveillance of swabs for influenza. So during influenza season, general practitioners who see patients who they think are sick enough to have influenza, not just a regular cold, they'll take a swab of their throat. So all those swabs that came in for influenza, we were also testing them for coronavirus in the back end in the lab. So we had a baseline, understanding of in the community how many corona cases out there, even though these people were not specifically coming to be tested for coronavirus. So because we have background surveillance in the flu swabs, we're also surveilling any admitted patients. So patients admitted with pneumonia or other respiratory illness, we were also surveilling them. So this gives us a lot of background information of what's happening in the community. And then at the same time, we apply our suspect case criteria to decide who we actually test on. So we didn't have so many of these tests in the first days. So we really had to decide who needs a test and who doesn't need a test.
Now, my next question is about preparation. When did you find out? I believe it's in December when Wuhan, the case broke out in Wuhan. Were you already prepared when you learned that Wuhan was infected?
Yes. So the day that the cluster, at that time they were just calling it a cluster of pneumonia at a Wuhan market. We all healthcare practitioners in Singapore received a message from the government that this is something happening in China. We're watching it. We're keeping a close eye on it. And, we'll keep you updated. Once we saw the case, has confirmed to be human-to-human transmission, almost immediately the hospitals went to some sort of preparation measures. So meaning canceling elective procedures so that your hospital wouldn't be filled up with people who aren't really sick, but are there for non-urgent cases like surgeries, like for cataract surgeries or plastic surgeries, which is not urgent. So we immediately stopped elective procedures. We immediately tried to decant patients who don't need to be in the hospital, send them out into community hospitals or less acute settings, preparing the space for the hospital, because if this comes to Singapore, your hospital can't be full of people who don't need to be there. Planning the hospital of how would cohort, if we're going to have people with pneumonia, we need to keep them somewhere separately from other people. So we're already planning this. Which wards we could convert into ICU beds, we are already thinking about this. So by the time we got our first case in Singapore in January, we were already doing the motions. And as soon as the country increased the alert level to orange, which is one of the highest levels in Singapore, then we really went full on, the SARS mode, where everyone's wearing masks in the hospital. It almost happened overnight. Everyone has to wear masks. The healthcare workers have to wear masks. The patients have to wear masks almost immediately. So we were just slowly ramping up since December when we got the first text that something is happening in China.
Mm-hmm. Wow. So you were able to anticipate early. You didn't have a shortage of masks, no gowns, anything like that?
No. The government actually keeps a stockpile of healthcare equipment in the event of a pandemic or something like that. So we didn't have any shortages of PPE. We're using it judiciously, so we're not just throwing away after every use. But I have to wear the same mask during one shift. I don't have to keep it for many days or something like that.
Okay. Now, how did you notice? How do you notice someone? What are the basic symptoms of a person carrying this disease?
So the symptoms are very similar to your common cold. They'll have a runny nose or cough or just a sore throat. And later on, some people, their only symptom is that they lose their sense of smell. We've also seen this. So the patients will present in different ways. Some present with, classic cough, runny nose. Some people have this, loss of sense of smell. Some people have diarrhea as a presenting symptom. But I'll say in the majority of the cases, it's the same symptoms as a common cold: runny nose, fever, cough, sore throat.
Okay. Now, there is an indication that the country who have been vaccinating their population against tuberculosis have a very low incidence of COVID-19. Is that a true statement?
This is another one of those anecdotes. So it's people who are observing and telling a story, but we don't have, as of yet, any clinical trial evidence that BCG will protect you against COVID-19.
Okay. Now let's go to the age group. People been saying, only kill older people. Younger people are safe. So what is your statement about that?
I would say that based on the statistics of the cases we have seen in China and in Europe and around the world, definitely older people are more likely to have more severe illness. And part of the reason why older people are more susceptible to severe illness is because at that age, you have a lot of other medical conditions like high blood pressure, high sugar, other diseases that may make you more vulnerable to severe infection. But these diseases like high blood pressure, diabetes, we're seeing them even in younger people, especially if you look in America. A lot of minority races in America have very high proportions of people with high blood pressure, with asthma, whom if they got infected with COVID-19 would also be at higher risk for more severe illness. So that's one aspect of it. But at the same time, we also have healthy, healthcare workers who are dying from this virus who don't have any known medical conditions. So we're not sure yet if there's some genetic predisposition that makes some people sicker than others. But it's quite clear that the older you are, the more chance you have to have more severe illness, the more comorbid illnesses, meaning that you have other illnesses besides COVID. The more illnesses you have, the more likely you are to have a severe illness. But these young, healthy people are also getting it. We don't have the answer for why.
Okay. Now, high blood pressure, smoking, radiations, all these symptoms who weaken your immune system, the person could be a potential receiver of COVID-19, right?
You mean people like cancer patients?
Yes.
Yes. So all these people with existing illnesses like high blood pressure, cancer, diabetes, they're more likely to fall into the severe illness group because actually 80% of the cases will have a mild illness. About 15% get a little bit more sick where they need to be hospitalized. And about 5% of people are very severe where they need ventilation and need to be in the ICU. So this is a very sick patient. Most of the people who are in that 5% are older or have comorbid other existing illnesses. Majority of us people will fall into the 80% who have mild infection or the 15% who maybe need a short hospital stay.
Okay, the society has been traveling a lot. These days,